The broadcast is now starting. All attendees are in listen-only mode.
Hi, everybody. We don't have a whole bunch of people on the phone, so I'm going to give it just another minute or two, and then we're going to get started. I'm going to give it to about 3:02, and then we'll get going. For those of you just joining, we're going to wait just another minute or two to let everybody get on. I can kind of be making announcements before we start. This is being recorded, and we'll send out the recording to everybody after the conference call. This is going to be weekly, except for the last, I think it's the last Thursday of October, but I'll confirm that. Of course, Thanksgiving Day and the time over Christmas. The purpose of this call is to really help everybody understand the processes and changes that we're making to the system. If you have a particular issue that you're working with, because it's multiple agencies on the phone, you can absolutely send me an email with all the specifics of what you're working with, and I can set up that scenario in my demo environment to go through and show you how you resolve that. But just FYI, we're not going to get into your particular database on this call because we don't want to have a HIPAA problem. But we're really going to look at going over what we've changed in the system, what we're going to, issues that we're seeing you guys are having so that we can make these all useful to you. I will kind of unmute you as we go along, so if you have questions, we can go through those questions. So I'm going to give it one more minute and then we'll get started. You also have the ability to chat with me if you need to chat during my call. If you've got a question and I haven't unmuted you, to be honest with you, I like the feedback, so I might try unmuting you just to make sure we don't have any noise in just a minute, so that I can hear your feedback during the call. Okay, let's get started. We might have more people coming. Let's see if I can unmute and everybody is good. Well, let's see. All right, let me keep going. I'm not sure I can unmute you guys. Okay, let me keep going. So let's start with, I usually do GoToMeeting and this is GoToWebinar, so I apologize. And the person that can assist me is on vacation. So let's just kind of go through this. So the first thing I want to start with that we changed, which I think should make every agency happy that we have on the phone, is that we now have changed your documentation to say electronically signed by. So if it's a visit note, it's going to say electronically signed by with their discipline behind the note. Electronically signed by, so if I'm a nurse, it's going to say electronically signed by Kathleen Spooner. If I'm a therapist, it's going to say PT. So that now appears on all of your notes, as well as on your orders and your revision to your plans of care. It will now say verbal order received and electronically signed by Kathleen Spooner or whoever electronically signed that. So we did put that wording in. I know that was a request from a lot of your agencies. So just know that that sits out there. So you should be good to go with that. Oh, can't see my screen. Thank you. Can you see it now? Okay, perfect. Okay, so let me just show that again. It's going to show you on your orders verbal order received and electronically signed by, and so it's going to give you that wording now, and all your visit notes will now say electronically signed by with the discipline as well. So I know that was a request of a lot of agencies, so that now has been fixed for everybody. So you will see that on all your visit notes and your orders. So now let's go into the system, and I want to go to Notes QA, and I'm going to walk through a couple of processes with you. One of the things PSO asked me to go over is importing orders. And so I want to just kind of show you guys the importing of the orders process after you have somebody that's already basically the original plan of care has been signed and submitted, and you want to figure out how to get those orders imported. So again, best practice is you're going to want to do this within 5 days, importing like disciplines onto the plans of care at Start of Care and Recert. So you can see I have my plan of care here, and the plan of care so far was just signed by the nurse and submitted, and then my therapist went out the next day on the 13th and completed the order. So when I click their assessment, when I click on the plan of care in the system, and I'll get it a second to load, if I hit the edit button, you will now see the import. When you click on import, you have the ability to choose which assessments that you want to import to make it one assessment. So you kind of control that in the main application in Notes QA. So when you hit that save button, it's going to pull both of those assessments, even though the nurse had only done it to start with. It's going to now pull that therapy assessment into my plan of care. So if I go down to my frequency and duration, you'll now see that it doesn't just have my nursing, but it added I picked the wrong discipline, but it added what I put on my therapy to be there. And if I go to my problems, interventions, and goals, you're going to see that it pulled my therapy goal in with my nursing goals by doing that import. If you have signed and saved, if you have already saved or edited it and saved, you're not going to necessarily see that important button. You're going to have to roll it back to the point it's awaiting QA review. So when it's awaiting QA review, that's when you're going to have the ability to do that import. So if your status is in QA review, or you've approved it and signed and now you need to import that, you're going to have to roll that assessment back to awaiting QA review to see that you have the ability now to import those assessments. So any questions about that? Okay, I'm going to go back up and find another assessment because I want to show you another well, let me go down here. I want to show you another situation that we have. So here's my plan of care in Susan Rhodes. And this is a process that we fixed because we do have agencies that will have an outside coder that's coding it, and you don't necessarily want to wait to approve that plan of care, just waiting on that diagnosis. So let me go through this process with you and how this process changed. So if I go to approve, you're going to get a message that you're approving a plan of care that doesn't have a primary diagnosis. If you want that to all flow onto the assessment prior to approving it, then this is your warning not to go through with approving that assessment and that plan of care. Not assessment, but plan of care. So if you are good with it being approved, even though the coding hasn't been completed, I can click OK and put in my password to approve that. So what that message told you is if I go to the steps of approving the plan of care, even though it doesn't have the diagnosis, and this one's going to go into conflict, for an incomplete one, it's going to automatically go into the orders dashboard as incomplete because it doesn't have that order. So let me go back up to Susan and let's approve Susan because I think I've got her admitted. So if I go, and now I'm going to say, let me go back on my plan of care, and I'll sign this off for us so we can approve it. So if I go show awaiting signature, here's my plan. Well, nope, she's not sitting there. Let me just click it again. All right, let's go. Let's just pick. Let me go back. It's good to know. I'm not sure why it's getting new signature. Okay, so let's see what our conflict is on this one. So we're going to go to conflicts and Susan Road, and our conflict is the POC date is different than the episode date. So let's go see what we've got. So we've got 8/17. And this might be helping some of you guys that are having this issue as well. So if I go down here, I have 8/14. So I'm going to roll back my plan of care to awaiting QA review. When I roll it back to awaiting QA review, I know it looks dark, like you can't edit. Oh, let me go to edit. I know it looks dark, like you can't edit it, but you can. So we're going to change this to be 8/17 because that's our start of care date. Now we're going to save it. Now we're going to approve it. It's giving us that same message. Now it's approved and signed. This is all working like it should be. So it still doesn't have a primary diagnosis on it, but it's not going to go out to the doctor, or you're not going to be able to send it to the doctor, because if I go to the orders dashboard and I pull up my client Rhodes, Susan Rhodes, and I look at all of her plans of care that she's got in here, it's going to tell me it's approved and signed, but that the status is incomplete. It's saying you think it's ready to go out the door, but it's not because it's missing that diagnosis. If I go to Susan and I add that diagnosis, so let's go up to admission details. So now your coder has come in and they've added that diagnosis. So we're going to come in and we're going to add the diagnosis of 11/1. Oh, wrong client. So let's close out of this. Let's get our right client. So Susan Rhodes. We're going to go to admission details. So Susan doesn't have a diagnosis. It's really important to remember that your diagnosis is not going to appear on your plan of care if the diagnosis is after the start of care date or after the restart date. So I'm going to come in and add my primary diagnosis. Going to add it as heart failure. Search, I'm going to pick my diagnosis. I'm going to pick my diagnosis date to be 8/1. I'm going to go back to 8/1. Going to add it. My assessment was done on 8/17. Going to hit next, finish. I've now got my diagnosis in here. I'm going to remember to save it on my admission details page. So my diagnosis has now been completed by my coder. So now if you go back to orders dashboard, and I'll try to be a little slow. I know I can screen pretty fast. Now if I pull up Susan Rhodes and I search, now it's ready to be sent. So when your diagnosis is added, it's already going to automatically move it to ready to be sent. So you guys can choose which process you want. If you don't want it approved till the diagnosis is on there, you're fine. But if you want it to be approved with only the diagnosis missing, it's going to automatically put it into the incomplete. From the incomplete, when that diagnosis is added, it's going to then automatically make it ready to be sent. So that's an easy process that now has been put into the system that way. So again, any questions about that, just let me know. But I think that's been pretty self-explanatory. One new thing that also changed, which I think is a big change that we made to the system, is now under business unit demographics. So if you want this to be applicable in your agency, make sure that whoever controls the setup of the system is aware of this new setup. But if we go down to where the point of care settings is, there's now a new section that's called Get New Signature for Comments. And what this does is this now makes it where in the past, if you just added comments to anything, it's going to make it where you had to approve it, then you had to roll it back and reject it. This now will allow it that whether or not it was a question that required, if you edited it, for it to go back to the Get New Signature. This now, if all I do is add comments, it's going to send it back to Get New Signature to that caregiver. So if I go up to Notes QA again, and I go Spooner, well, let me put the caregiver Spooner. And I search. And let's go to a nursing visit note. So if I click edit, that I'm going to edit that nursing visit note. Let's say I go to vital signs, and she didn't put vital signs on here. So now I'm going to edit and add my comments. So let me go add comments. Need vital signs documented. When I save that now, it's going to now populate the Get New Signature. So if I send this back to Kathleen with that comment on it, Kathleen can now pull it up and it'll be highlighted just like you editing a question, that it highlights it for them on their device. It will highlight it for her as well. So if we go back to our point of care, and let's go back to our home page and pull up Gem Collector, or let's show only signature. So let me click to bring it over. I'm not sure why that's doing that. Let's go to Gem Collector here. He's got a visit note. Let's just go on and see. So if I go down to my 817 note, it will populate in your environment. I need to check what's going on in my environment. Well, maybe I wasn't the person that did that visit. Oh, they will see when you click Show Only Changes, they're going to see the change in the comments that you made. So it's going to auto-populate Get New Signature. You no longer have to approve it, reject it. It's going to pull it over to the device for them. So important to note. So let me search and see if it removed it. 817. Okay. All right, let me just click here again, maybe because I didn't finish the process. If not, I'm in my demo environment that is not always 100% updated with your environment, so I will make sure that's working, but I did get it confirmed that it's working in production. Okay, why I'm on this page, one other thing to talk about, the number of days to be displayed. We made a decision that I know there's a lot of tickets in asking us to delete required documents. And we absolutely felt like that if we allowed you to delete required documents, it really kind of changes even what a required document is. And it's not so much a problem in the back office because basically you can ignore what's in the back office. An incomplete document, a not started document is going to sit in Notes QA for forever. So if I created a second assessment and did the assessment that wasn't required, that one that wasn't required still went through, got approved. The one that was required is just going to always sit in Notes QA as not started. Who that's really a problem for is the clinicians on the device, because they start getting a muddled, incomplete document for all these documents sitting on there that really aren't incomplete because they completed it. They somehow completed the wrong one. When some people, when you guys went go live, it's hanging on to those required documents prior to go live. So what we've added is number of days to be displayed. So this is where the clinician now has the ability to add the number of days to kind of filter out those documents that truly aren't incomplete and that they no longer need to complete. So this now is the tool that your clinicians can use. You can see here I have 8. If I go back and delete that amount, I have 18. So just be aware that if you've got clinicians that are having issues with that, if they change this, and really and truly they shouldn't have any document hanging out that's truly a live document more than the last week or 2 weeks, a couple of days, or even today. But they can change now this filter to truly help them get what's really an incomplete document that they need to complete. All righty. Next, let's see. The other thing that I'm sure you guys have already noticed, and we got asked a lot, is now the default days. Some of you that have a lot of business, if you forgot to change this filter, your system would spin for a while trying to bring up, or you'd get a message that there's over 1,000 documents in those 90 days. And it was a little bit bothersome to have to remember to change these days or to make it specific to one caregiver. So now these days auto default to 30 days. So it's just going to bring up the last 30 days of documents. Again, you can always go back and change that if you need to go back and look at something prior to that time, but it does now auto default to 30 days to assist you guys. All right. The other issue, there was an issue with drugs pulling in the back office versus drugs on Medispan in the client database, and it really had to do with how many characters Medispan was looking at to populate the medications. That now has been fixed in the system. So your clinicians will see the same drug database on the device that they see in the back office. So as they go starting to, let's see, I think acetaminophen might have been one of those. As they start putting in that information, it's going to take them a few more characters to pull up the drug, but it's going to give them a much longer list that matches everything that's in the back office now as well. So those drug databases are now exactly the same. Okay, let's see. One of the things that we changed this time, and I know we had this request from several of you, especially those of you that truly have a lot of diabetic clients. On the diabetic foot control, it incorrectly said wound on the filament checking on the foot. That now has been corrected. So if you go to diabetic foot exam, it now will just say location. So it no longer says other findings. It no longer says wound, but it says each location. And as you drop and drag, it does not give you a wound, it gives you location type. So you can choose that it's a wound, but it does take out that wound for you and makes it location. So that did correct that error as well. Okay, we did, just so everybody knows, plans of care and revisions to plans of care are considered standalone forms and need to stay as a standalone form in the system. So they no longer are attached to just, let me go back up here. I'm sorry for all the scrolling, but let me show you. Let's go to September 1st. And I'm going to pull up all my visits and forms. Because if you have a plan of care that is attached to the visit, when you go to try and change that plan of care, if it's not, let me go down to my client Jeffries. If it's attached to the visit and sitting on that same visit line, you can't basically roll that plan of care back or that revision to plan of care back to correct anything that you need to correct because it's attached to the visit. So basically you have to go into the visit, unattach the plan of care, roll it back. So even though it's still part of the visit on 812, it is going to sit as a standalone form on that visit so that any edits or changes that you need to make to that plan of care, it's not attached to the visit to unattach it to have to make those changes. And that's the way it should have always worked. So just so you know, that is something now that is automatic in the system. Those will always be standalone forms going forward. Okay. The other thing that we got asked to do, which I thought made a total ton of sense, as you create versions in the system, as the forms going back or forth, and you've got different versions in the system, I only have one here, but if you had version 4, version 3, version 2, and you wanted to print that particular version, maybe you want to print it so you can compare it to the next version. Prior to the last release, the system would not allow you to print the individual versions. The system now going forward will allow you that ability to print the different versions that have been created. So you now have that option. When you click the version and hit print, it will bring up that particular version that you selected. One other thing that was changed, and I personally love this change. I'm hoping you do too. This has been a little bit, but there's another piece of it. So let me just kind of cover everything now. So on your client, and I created one today, so I'm going to just go to my reviews as soon as he comes up. Prior to this, when you guys did a medication review, it did not ask for the electronic signature of the employee. So when you guys printed your medication profile in the back office, it didn't register those electronic signatures. It would just say electronically signed and be blank. So you guys would have to print them out, have somebody sign them, get them back into the system so that you met regulatory requirements. Now the system will absolutely make them, if they edit or do anything to it, it will ask them for their electronic signature. And they do have the ability to edit it, because I was concerned that if I accidentally made something a problem that wasn't a problem because I wasn't paying attention and clicking, it didn't give you the ability to go back and correct that error. So now it does correct that error, and it does capture the electronic signature. So in the medication profile, so let me go back and pull up my client Jim Collector again. If I go to the medication profile, sometimes I just find it easier. Let me click on Jim, and let's go down to clinical. It's funny when you're on these things how you sometimes just can't find something for looking at it. So when I go to the medication profile now, 2 things we changed recently with this. The first one is it no longer prints your discharge medications. This was a request we had, which I think makes total sense with the new regulation, ensuring that you're giving the medication profile to the client. And we do have that patient plan of care report in the system to pull that if you need. But I felt, and the other agency that submitted this felt, and I felt it was a real regulatory thing, providing a plan of care, a medication profile to a client that might be slightly confused, that had discharge medications, could potentially be a medication error. So that now has been resolved. The discharge medications no longer appear on the medication profile. And now you will see that the medication review will capture who provided that medication review. Okay, a few more things. One thing I want to make sure, this has been a ticket that's come in. You can edit revisions to plans of care in Notes QA. You can edit the frequency in Notes QA, or your clinician can edit it on the device, as long as it doesn't have a revision to plan of care that's been approved and signed afterwards. If you find that's an error, you're having a problem with that, or it's an error, please reach out to us and let us know. We're happy to look at that for you and make sure that we're getting everything correct for you. Okay, so the other thing that PSO asked me to cover is in Notes QA, just to remind everybody that if I have a plan of care, so let's just go to advanced search and let's find a plan of care. If you have a plan of care that has not been approved yet in the system, when you hit print, it's only going to print what's on the form currently in the print form button. So the print form button is only going to show you what's on there currently. Once you approve the form, then you can hit the print 485 button, and that button is going to give you how it's going to absolutely look when it goes out the door. So if you're in the editing a plan of care or revision to plan of care and you really want to see how that form's going to look, hitting print form is going to show you. Once you approve it and sign it, you can hit the print 485 button, and it's going to show you how it would look going out the door. Once you hit that print 485, and it doesn't look like you want it to do, you can roll it back, make any changes that you need to make, and then you're good to go. I did get a question about diagnoses not being shown here on the system. If you haven't added them, that's something we're addressing now. To have it where if you make a change to the diagnosis, they will auto flow into Notes QA, even with that warning still being there. So if you haven't approved it and the diagnoses are added after the fact, that those will flow. So that will be coming out in a future release to help you guys with that issue, because I know that you want to see, some of you want to see everything on that plan of care and Notes QA. So that is something that we're looking at. And let's see. I'm thinking that's everything that I had for today. Let's see. Any questions? You guys might have to chat me as I'm not... I tried to get everybody off of, and I can't see everybody to get them. I can't get you guys off of mute. Oh, let's see. So if you've got a question, if you want to chat me, if you've got an issue again that you guys are kind of going through and you're just keep getting hung up on the same thing, if there's a topic that you guys want us to start covering every week when we do these, I'm happy to do that. That's really what this is about, is to make sure that we're kind of keeping you guys update to the changes we're making. We're hoping all those changes are improving your life. So again, if you have a specific scenario, email me, kspooner@compliahealth.com, and we will put that on the next training. Val will be on the next one, so she can make sure that I can unmute you guys to take any questions that you would have. Again, we're going to cover release notes in this. We're going to answer questions. We're going to keep training on issues that we're seeing in support that maybe are causing more than one of you guys to get hooked, have issues, or even one of you to have issues. So we want to make this a very useful, productive point of your time. So again, if you just absolutely email me questions, concerns, something you want me to demo, we're happy to do that. So I don't see any chat messages. So if we don't have any chat messages, I will close it out for today. I will make sure that I I'm going to send out the video to everybody so that you guys have that readily available for you. Any questions? Let me give it just another minute in case somebody's going to respond. Let's see, one. Questions? Okay, hold on. I do have one question, so let me go up here. Will POCs ever have the ability to import assessments onto them? We're kind of thinking about that. I mean, that could kind of become a big mess. So it's kind of something we've got to work through what that process would be, and if it makes sense to do that. But yes, that ticket is out there, and absolutely it's something we're looking at. We just have to work through, does that kind of make sense to do that for everybody? So you'll be updated on this call if that truly is, we got it to the point we think it makes sense, and we put it into the process and put it in a release. So we haven't ignored that one, in other words. Any other questions? Let's see, I got one more. Let's see. When is webinar for clinical staff documentation interface understanding for the new users? Actually, you can, I think I'm not 100% understanding this. So are you asking, when are your users going to be updated on a call like this? I would say reach out to us and let us know. Most of the time we're training you guys, the super trainers, to go back and update your staff. But if you feel like it needs to be more to clinicians as well, let us know and we'll look into that. If I'm not totally understanding the question, just let me know and we'll work through that. If you feel like your group's whole clinical body is having trouble, then again, circle back to us. Any other questions? Let's see, I think I might have one more. Oh, I think I got that question twice about the RPOCs. Will this be the same training every week? Nope, hopefully not. Hopefully we're going to change the topics every week and cover a different topic every week, or different issues that are coming up, or what's coming out in a release and how that process will work. We understand we're sending out a lot of releases with very small release notes, and we want to make sure, like that diagnosis piece, that you're understanding how we change the process, so that we make it much better for you guys to catch that process early to be able to train for it. So again, we don't want it to be the same every week. So if you have issues that you're seeing, that your group is seeing, in your operation, where they're struggling with something in Notes QA, they're struggling with something on the device, and you want us to talk through how they should be using it, what should be best practice, please send those emails to me, kspooner@complyhealth.com, and we will absolutely try to cover different topics every week. So we want to make this 100% meaningful to you guys. Let's see if there's any more. I hope this was meaningful to everybody. Let's see. And that's really what the goal is. I'm a clinical staff in the field. Absolutely. If you're a clinical staff in the field, you absolutely can get on these calls. We don't have a problem with you. There's only going to be a portion of it that we're showing on the device what's applicable. But if you feel like you want to join, it's not a problem for you to be on the call. Yep, let's see. Let me look at hers. Hold on just a second. For day-to-day documentation. Yeah, for day-to-day documentation, again, if you guys feel like your staff is struggling with the day-to-day documentation and you want to take us to take a week that makes it just the documentation for clinical staff that week and really don't even go into Notes QA and go through how it works now with all the changes that we've made on the device, I'm happy to do that. Just let me know and we'll absolutely cover that. Will we be able to upload some of our forms into my device so that you can, into my database so that I can show you the issue? I guess I'm not 100% understanding the question. But yeah, if you've got a specific form that you are having an issue with and you want me to look at, I'm happy to do that. We also can have PSO look at that for you. It doesn't necessarily have to be on this call. Do you have a topic list? I will try to go back out and get a topic list. This time it was releases, so I will try in future to send out an agenda of what we're going to be working on. So I will absolutely do that for you guys. When we receive a workbook to go over with clinicians, when will we receive a workbook? Again, I'm not understanding that. Are you talking about training materials? If you could clarify that with me. Are you talking about the new updates that you want that information to be provided to you in a training manual for your clinicians? Again, if you can just clarify for me, we will see that that happens as well. Our goal is to become much more user-friendly to you and to your staff as we're putting out these changes, like a weekly, monthly view. So Jan, let's see. All right, so is it possible for clinical staff to see a calendar of their patients like a weekly or monthly view? So yeah. Yes, they do. Oh, you mean on their device? They see the schedule without, they see the schedule with the client name. So let's go back and look at that. Yes, we want a training manual for all of our clinicians. Okay, we do have a training manual already, Mary. So if you could send me your email address, we will make sure that PSO gives you an updated training manual for your clinicians. Okay, so to answer the question, on the calendar view on the client, now I think they can hover over it, and what it's not doing is showing who the client is. It shows who they are. So you want on this page for them to be able to see the client. So this was not on the old system. That's why it's currently not on this system. Currently, the way that they have to do it for that month is to do it by a date range search, which brings up the client's names. There is a ticket in to look at putting it in the calendar view, but currently that does not exist. So I can go out to, for example, October 13th. And I get for your clinicians that want to look at who I'm seeing every day, this is a little bit problematic to go through. Let me get it where I have it right. This is a little bit of an issue to figure out what day. And you know what? 9/13, 9/13, that's kind of a hard view to see. So yes, we'll look at seeing, does it make sense to, and put the client names on that monthly calendar for them. Okay. All right, Mary, I got your email address and you want the training guides. Okay, I've got it. Let me write it down right now. I will make sure that PSO reaches out to you, and you're specifically looking for the training guides for the caregivers, and I will make sure that that's done as well. All right, anything else? Any other questions? I don't want to make sure we short anybody, and I do want to make sure to move appointments. Oh, Thank you so much. I want to show you that. That's in here. So thank you, Jan. Yes, you can change appointments from one day to the other. So let me show you that. Thank you, thank you, thank you. I completely forgot about that. So, and I had to be corrected on this as well. I will just say this because I was under the wrong impression on how to do this as well. And so most of us think that if we go here and I want to change this visit to be on the 15th, and I try to save it, you were getting a message that says your visit has to be longer than 7 minutes in duration. But development kind of straightened me out on this, and we changed the message that they get. So it now says you're attempting to move or change a visit that's in the future if you click on the schedule service change button in order to perform this. So this button I can use if I'm moving a visit to in the past. So my visit was today, but I'm moving it to yesterday, and I know what my time in and my time out were. Really should have very few of those, because really and truly your clinician should be at least populating portions of their visit note on the day that they did it. If you need to move this visit to in the future, you now click on schedule service change. You put in the date to the 15th. You do not have to put time in and time out, and you click OK. It says, are you sure you want to move this visit from today to Saturday? If you click OK, it will now move that visit for you. It's going to tell me, because I just got an error message because I was trying to move it outside of my treatment week. So it's not going to let you move it outside the treatment week, but I know I have a visit on this client tomorrow, I'm pretty sure. So let me go back and capture the next one, and we'll do the next one for today so you can see everything from start to finish. So if I go to Brett Green and I need to move his visit tomorrow, I click on schedule search. I say I'm going to move it tomorrow. I click OK. Am I sure I want to move it? Click OK. It will now tell me my visit has been refreshed. So it's now putting my visit from today to the 14th. If I go back to my home page, I will now see that Brett Fox no longer sits on my schedule for today, but he sits on my schedule for Brett Green. He sits on my schedule for tomorrow. So we changed the wording in this last release when your clinicians are trying to do that to absolutely show them the correct method for doing that. So if your clinicians are struggling with that, again, they just go to schedule search. This is also where they change the service. So if I'm your PT and now it's a PT eval or reassess, this is where I change the service type, and I can put my visits in the future. I just can't put my visits outside of the treatment week. Okay. Thank you for asking that question. That was awesome. That reminded me that's been fixed. So that's how you do it. So absolutely. The one thing I will say is I will make sure that we kind of get instructions out to you guys on most of the things that I covered today. So I'll try to send a video as well as create a one-page handout that goes over the things that I covered, so that you guys have those. If for some reason I missed one of those, please feel free to email me back, and I will make sure that we have it in your guys' hands. So again, we're trying to get much better at providing you guys to get stuff done. Absolutely, Jen, I agree with you. That's why we made it possible for them to see that. Okay, will it be possible for the software to create all the RVs for the frequency once we add the frequency in the POC? I think that's going to come in a future release, but basically it probably won't work exactly like you think it will. It will probably be a little bit easier. I don't have a time frame for it, so I'm not going to quote when it's coming out, but we are looking at if they plot their visits on a schedule, will it automatically create the frequency for them? So it's something being talked about, not on the roadmap, don't have a time frame yet, but it is something we're looking at. I think that's all. Again, I want to make sure that when I show things that I give lots of time for questions every week. So we'll hopefully do that for you guys. So my goal is I'll get the video to everybody. I will make sure that I recreate screenshots and one-page documents over might be more than one page, but one topic of all the things that we went over today and get those out to you guys. I'll make sure that all of you that don't have the training materials for Clinical Edge for your clinicians, that PSO gets those to you. Again, so if I didn't have your information, so hopefully you'll have a one-pager that you can, a bunch of pages you can hand to your clinicians about all the changes we've made in the system, as well as you'll have a YouTube video that you can refer to. Keep sending in, and again, if you've got processes your clinicians are struggling with, you're struggling with, let me know. We'll cover it in future topics. If you want me to take 1 week, that we go through start to finish, how your clinicians utilize the system with the changes that made, we'll be happy to do that as well. And I will give you out a topic list. The sooner you guys get those things into me, the sooner we'll get the agenda out to you guys. So again, any questions, anything we need to go over next week, please let me know. I'll try to get an agenda together and get it out the door pretty fast. So if you've got anything specific, please make sure you email it to me pretty fast. And I agree, Jan, if you know what the topics are, you'll have the ability to make sure people attend. So we'll definitely go from there. I feel like right now, the most important thing is making sure your staff know how to use Notes QA, because really and truly, you guys have the power in Notes QA to fix most of your issues. And so I want to make sure you guys understand that. And so a clinical one might be a little bit further down. My email, and I'm going to send this out to everybody and give you a minute so that you have the ability to see it. Okay. So I'm sending my email to everybody so that you guys now have it, so that you can definitely email me. And again, hopefully I'll have the agenda out by tomorrow, and I hopefully have the handouts and the video out to everybody by tomorrow as well. So anything else before I hang up? I don't want to hang up on anybody. I hope you guys found this useful. Again, the goal is to get everybody really comfortable. It's a big change from the old system, and to get you guys all really comfortable with the system and your staff really comfortable with the system. All right. I think that's all. If nobody else has any other questions, I will be talking to you guys hopefully next week. Hopefully talking to you guys next week, and hopefully this will become a meaningful part of your time every week, or your staff's time, to make sure that we're letting you know what we're doing to make their lives easier, and we're making your lives easier. So thanks for joining. I appreciate it, and I will talk to you guys later. Have a good one.